Hey there, welcome back to Health Made Simple, the channel where we take the complicated stuff your doctor throws at you and make it, well, simple. And today's episode really hits close to home. It's about diabetes and uncontrolled diabetes. And it's about my dad, his journey, our family's wake-up call, and what every caregiver needs to know before it's too late. Unfortunately, perhaps with my family. I'm a registered nurse. I've seen what diabetes can do in the hospital, but I've never thought I'd watch it unravel so quietly and severely. So here's what happened. My dad's been diabetic for a number of years. He's been taking metformin for a number of years. He's been taking it like clockwork, or so we thought. But what no one really caught, not even his primary care doctor, nor his endocrinologist, no one, was that his A1C was chronically high for almost a year. So how did we find out? Well, not through a checkup, not through lab results. We found out because we ended up in the ER, thinking that he might have had a stroke. My mom, his primary main caregiver, noticed that he was getting more confused, kind of slower, weaker. She insisted something was off, and we listened. His primary doctor ordered a head CT just to rule out any head bleed. That ER visit turned into something else entirely. Go figure, right? His blood glucose level, nearly 300. He was in a diabetic crisis. The ER doctor took one look at his labs and said, you know what? He's not going home today. We need to have it under control. So the doctor admitted him to the hospital. That's when we learned his A1C had been in the danger zone above 9% for who knows how long, at least a year. Now he's on insulin. He has to take that every day, daily injections at home. The good news is that the CT came back clean. There was no stroke, but the diagnosis, vascular dementia. And that's a story for another day. But you can imagine really the emotional gut punch, because now we have that dreaded word, dementia. So let's go over what A1C is. It's so important. So let's back it up. What even is A1C? Hemoglobin A1C is a blood test that gives you an average of your blood sugar levels, well, over the last 2 to 3 months. It's different from a daily glucose test. It's more like your blood sugar, a report card for the 2 to 3 months. Here's the breakdown, the levels. So normal, the A1C would be below 5.7%. Pre-diabetes, anywhere from 5.7 to 6.4. And diabetes is 6.5% or higher. Now, I know these numbers well because I was once pre-diabetic. My A1C was up there at 6.3. But I turned it around with exercise, Muay Thai, yoga, and a major diet reset. Well, why? Because as a nurse, I've seen what happens when people don't fight it. And I can see that with my dad. I was able to bring the A1C percentage from 6.3 to a normal range of 5.6 with just keeping my exercise, regular exercise, and really stopping. I used to eat a lot of fruits in the morning by itself with no protein, and that really shot up my glucose level. So I stopped that entirely, and I think that is what was helpful. If you're interested, I'll have a link of the video at the end of this video. Uncontrolled diabetes, a huge problem for America. let's talk about the consequences of uncontrolled diabetes. Because diabetes, when ignored or unmanaged well, doesn't just hang out quietly in the background, unfortunately. It destroys your health. Here's what my dad deals with now because of the uncontrolled diabetes. He has peripheral neuropathy, and that's essentially nerve damage from long-term high blood sugar. So he describes this as numbness, tingling, like ants crawling up his leg. He also has retinopathy, which is damage to the tiny blood vessels in your eyes. He wears glasses. He also has hearing loss. He wears hearing aids, though only when he feels like wearing them. And he has frequent urination, which is really a classic sign of poor glucose control. He's always taking a bathroom trip, and unfortunately, because of that, it really prohibits him from going out. And if we do go out, we have to kind of schedule and make sure there are bathroom breaks, which is not a big deal. But the big deal is having this high blood sugar level in a chronic state. That's something you definitely want to take care of as soon as possible. And now, vascular dementia. Well, high blood sugar damages the blood vessels in the brain, leading to many strokes and potentially cognitive decline. That's what we're dealing with now. It makes caregiving a little bit more difficult for my mom. And there are 38.4 million adults in the US with diabetes, and 1 in 5 don't know they even have it. Can you imagine? I mean, I was one of those people. If I didn't do an A1C, because I'm a nurse, so I know that that value is important, and it's indication if you're pre-diabetic, you have an opportunity to change that to normal so it doesn't turn into a full-blown diabetes. 1 in 5 people, although they have diabetes, they don't know it. And it's so important that you have these regular checkups, because the cost of having diabetes, it's enormous. It costs billions of dollars in direct medical costs and also lost productivity for a lot of Americans. So really check your A1C, particularly if you have parents who have diabetes, or if you are in the category of being overweight. So I want to emphasize the importance of routine checkup. Here's the part that still gets me. My dad's A1C was elevated for months, close to a year, and no one caught it. Not one provider flagged it. Supposedly their system flagged it, but somehow it got missed. Maybe it got buried in the system. Maybe it wasn't even ordered. I don't know. I honestly don't know why this happened. So, caregivers, here's your takeaway. Ask for the A1C test at least twice a year for your parents or people with diabetes, maybe yourself. And review the lab results, because unfortunately, even if the lab's results are high, it may necessarily doesn't mean that the doctor will call you. So the most important thing is, well, what's the plan if it's too high? And don't be afraid to be that daughter or that son or that caregiver to ask those questions. It might just save someone's life from diabetes complications. Now, here's some good news. Thank goodness, right? There are programs to help. If your parents, like my parents, have Medicare, ask your doctor about the Medicare Diabetes Prevention Program. It includes, and it's a really good program, and I'll put a link about that in the description section of this video. It involves 1 year of lifestyle change coaching, helps with healthy eating and exercise, free access, get this, to a health coach. Yay! But I think the elephant in the room is that even with these programs, one, not everyone knows about it. And two, not many providers even refer patients to these resources. I have no idea why, whether they don't know it or they're just too busy with the load that they have. But these programs are out there and it's free. But with the caveat being that first you know that information, and then secondly, how do you tell your parents that they need to go to this? Now, my parents, being immigrants, we did not grow up here knowing about these programs. So for them, it's very difficult to have this idea that there are programs to help them. It's more like they're in their head that they will take care of themselves. So if you are a child that are taking care of your family member, your parents, it's almost like you really have to give them the information in a way that they could understand it, and even take them to whatever resources that are available, because on their own, I know my parents would not do that. And if you have parents that you have challenges about doing something like this, please comment in the comment section. Also, some insurance plans cover something called continuous glucose monitoring, which makes really tracking blood sugar way easier. And don't forget about diabetes self-management education program. These are often offered for free or low cost at hospitals or community centers. So take advantage of those. And I mentioned throughout the video about the family dynamics. We can't avoid that, right? So with vascular dementia, it's caused by reduced blood flow to the brain, often from strokes or chronic damage, like from high blood sugar. And there are some memory issues, some confusion, and mood swings. And my mom sees this daily. Unfortunately, mood swing is a big challenge in terms of my mom trying to take care of my dad, because he could be calm 1 minute and then something will trigger him to get irate about something that is very it's trivial. So those are things that a caregiver may find challenging with personalities when people are dealing with dementia. So those are things that you want to watch out for. And also speak with your doctor if you are helping and someone is, let's say, with dementia comes to sometimes depression or anxiety. Those are things you can speak with a doctor and have them address that, perhaps with medication or some kind of behavioral therapy. And one thing we did, and I'm sure you might have also with your parents, is that we've had conversations with my mom about assisted living for my dad. And we've had it more than once. But my mom, it's her, she refuses assisted living for my dad. She wants to care for him at home like she has been. And that's what we call family dynamics, right? But I'm sure we're not alone in this. If you're in that same boat, drop a comment below. Let's talk about it. Well, what's working for you in terms of this family dynamics? What's hard? Are you trying to manage it all yourself because you can't? Or have you brought in help, which is also very hard to do too, finding help? Your story might be the one that helps someone, well, breathe a little easier. Here's some closing thoughts. Watching someone you love change before your eyes because of a disease that could have been managed or prevented really hits home, literally. But here's the thing, we don't live in the past, we learn from it. If you are pre-diabetic, fight now. If you're caring for someone with diabetes, well, stay curious, ask questions, and really check the numbers. The one thing that you can do well is advocate for your parents. And if this episode resonated with you, hit that like, subscribe button, and share this with someone who needs to hear it. In our next video, we'll take a deeper dive into vascular dementia. Dementia that not a lot of people know about or talk about, and how it impacts families and the resources out there that can help. And remember, health doesn't have to be complicated. That's why we're here for. Thanks everyone for watching. Stay healthy, and I'll see you next time. Bye-bye.